Well, if you are making those morning smoothies, trying to start your day off right, there's an ingredient you may want to leave out. We're also taking a look at how thunderstorms affect those with asthma. This is a big one here, too. If you're someone who suffers or you know someone who does, we've got Chief Medical Correspondent Dr. Cory Hebert joining us this morning with a look at these health headlines.
Yeah, this is very, very exciting news, okay? Some good, some bad. So if you are out there and you love a smoothie in the morning and you are putting a banana in it, you're messing up, man.
Oh, no.
You're messing up.
But that makes it so good.
That makes it so good, right? But this is the deal, man. So in the Journal of Food and Function, UC Davis, University of California, Davis, did a study to show if you put bananas in a smoothie, you are going to decrease your level of flavonols. Now, what are flavonols? Flavonols are things in that your brain needs for function, heart health, memory, decreased inflammation, and decreased inhibition of blood flow. All right, so increased blood flow, you need these things. But there is an enzyme in bananas called polyphenol oxidase. And this decreases the amount of flavonol that you have in that smoothie by 84%. Now, it doesn't mean that bananas are bad. It means that when you put them in a smoothie with mango and pineapple and grapes and all this other kind of stuff, those things are very high in the flavonols. So this enzyme in the banana inhibits and decreases the amount of flavonol. So you just shouldn't eat that with that. So eat a banana, but don't eat it with, and don't put it in your smoothie. It makes it so smooth, you know what I mean? Hence the name.
It does.
Smoothie.
Okay.
All right, but I mean, do you use the?
I put bananas in mine too.
Do you? Okay,
yeah.
all right. But we look, you know, it's really important because look, we talk about memory and blood flow and inflammation. It's very important, folks. So no more bananas.
You can still have the banana, just not in the smoothie.
Yeah, just not in the smoothie. Okay.
All right. Noted.
All right. Now, the bigger story here is that we have a lot of asthma in Louisiana, and New Orleans big time. When I worked in the ER, I worked at Tulane ER, worked at Children's, we used to see an increase in people coming in with asthma attacks when it would rain or thunderstorms. And we didn't really know why. Well, we know why now, and it's very, very serious. So American College of Asthma, Allergy, and Immunology, they presented this at the conference about a week ago, and basically they looked at 4,500 folks. And of those people that had the asthma attacks, right, 14% of all the asthma attacks over a year were only on the 38 days that they had thunderstorms. All right, so that means that this is very real. So Harvard looked at as to why, and basically cold downdrafts will concentrate the mold, and then the thunderstorms and the wind breaks down this mold and these particles into much smaller particle size, and then you inhale them more, and it causes an increase in your asthma attacks. So at this point, 18 asthma visits on average were on thunderstorm days, on 18 average visits, and only 3 visits on non-thunderstorm days in the ER, folks. So that means if you literally, we are looking at some policies now, if it is a thunderstorm day and you know it's going to be there, you need to have for your patients and for your children at home, right? You need to have a plan, a thunderstorm asthma plan that you can go to prevent your child or yourself from having an asthma attack when there are thunderstorms. And we have them so much in New Orleans that contributes a lot to all this. So, I mean, that's one that you really got to pay attention to, folks, and then act accordingly.
That's an interesting one. Okay. If you missed any of these health headlines, be sure to check them out. We include them all on our website, WLTV.com. Thanks for coming in and giving us this insight. Those are interesting for sure.
Absolutely.